My name is Hongju Park from Asan Medical Center, Seoul, Korea. Thank you for giving me a chance to give a talk about our result. I'm going to talk about the prediction of CI performance using machine learning and the changes of auditory and associated cortical volumes by deafness and the effect of changes on the CI performance. So when we see a patient with hearing loss and deafness, it's hard to tell the prediction of the post-operative CI word recognition scores. For example, when a patient with a 50-year-old and the post-operative result would change from the 5% to 90% here. So it's pretty hard to tell the prediction of performance. So we know that many factors are related to the CI performance, and we tried to prediction, but we usually generally use the general linear models. So the prediction power was not so high. So we, in this study, we used a non-linear random forest regression models to predict the post-operative result. And using the non-random forest regression models, we could decrease the mean absolute error up into 5% from the 15% using the general linear models, which means that the this kind of machine learning technique could show the most accurate prediction powers. When we omit the one factor and we calculate it, and if we see the big change, we could guess that the factor was very important. So we think that our results show that deaf duration was the most important one, and AJCI and duration of hearing aid use was the third important factors. When you look at the data in detail, so when we reanalyze the data according to the deaf duration, so when the deaf duration was less than 10 years, and we could see the pretty high, good post-operative result. But when the AJCI was pretty young, we could expect more higher, around 90%. But when the patient age was around 70, we could expect a 60 or 65% of post-operative word reaction scores. But the depth duration was more than 10 years. This is green line. And then we could see a little bit good result. However, we could see the outliers. But when the depth duration was more than 20 years, there are wide variety of post-operative results. So this kind of wide variety can be explained by the decreased number of superior ganglion cells which the CI stimulate. However, we think that the brain changes might also be important for these findings. So before we go into our result, we should know that auditory cortex is located on the superior temporal lobe, and middle temporal lobe is related to the learning of language. So this is what we analyze the data, and we use the coronal T1 weighted MRI images. And this is our result. So we could see the decrease of the volume around the whole brain, and especially on the specific areas, superior temporal and middle and inferior temporal cortex, and a certain area of motor and sensory areas. So this kind of motor and sensory areas were related to the lower face and jaw and tongue, which we could expect that such kind of, because they couldn't hear, they do not use their lips and tongues and throats and pharynx. And when we could understand that. So, and we also analyze the volume changes of the superior cortex, temporal cortices, which including auditory cortex. Interestingly, the volume of the superior temporal cortex decreased. However, after 20 or 30 years, the volume increased. We think that this kind of change might be related to the cross-motor brain reorganization, which means that the visual input might be processed in this area. However, the middle temporal cortex was continued to decrease, which means that this area is directly related to the hearing and language learning and language processing. And which brain cortical areas are related to the for the prediction of post-operative CI, so we could find that the bilateral thalamus and the left superior temporal and middle temporal cortex were pretty good, important cortical volumes, which can help in prediction of the post-operative CI. So when we look at the heat map, so this is a low word recognition scores and high recognition, and a large value of the duration of deafness, which means that the duration of deafness is high, and then we could expect a lower word recognition scores. There is a tendency, however, it is not always true, because that the individual patterns show that poor and good outcomes could be explained by a specific feature, not by a specific, but by a combination of multiple features. For example, here, superior temporal cortexes, generally, the lower superior temporal cortex show the better result. However, even the large superior cortex can, but if the middle temporal cortex is pretty high, and then we could expect a higher post-operative work accuracy scores. So in summary, so elderly post-operative deaf patients can also get good post-CI performance, and auditory cortical volumes decreased by deafness, and can be used as an imaging marker for prediction of post-CI performances. So we think that further studies can be helpful for the relationship about the dementia and brain atrophy, and related to the hearing loss. So I'd like to thank all the audiences and our collaborators, and thank you for your attention.